Hi everyone, my name is Janet Chi. I'm the founder and CEO of Pure Minds. Truly excited to have you here. For years, our team has been working very hard on one goal, changing how the world understands and treats our brain. The truth is, mental health and neurological care have been stuck in the past for far too long. At Pure Minds, we're building a future where brain care is personalized, predictive, and proactive, not reactive. Over this series, you'll see how our science, technology, and partnerships are coming together to create something that is truly powerful. And to our shareholders, thank you for believing in our long-term vision and standing with us as we build it right. This is just the beginning, and we're excited to take you with us.
What originally pushed you into brain health and neuroscience?
Pure Minds was founded in 2018. Founding Pure Minds had a very personal and emotional reason. In 2017, a very good friend of mine, famous radio host and music director Maestro Carrie Stratton, was diagnosed with ALS. At the time, I was sitting on the board of Toronto Concert Orchestra, which is a professional orchestra and charitable organization that he founded. He passed away in 2019, merely 15 months after diagnosis. Before his death, he invested in Pure Minds, and after his passing, his wife invested in us again. This was my first close encounter with this most horrible disease in the world, and they placed such a hopeless faith in me to find something for them. In 2020, Pure Minds received a controlled substance license from Health Canada, and we set up a neural lab and hired brilliant chemists and neuroscientists. The quest for the breakthrough solutions for neurodegenerative diseases began, and our focus was on neuroplastogens such as psilocybin and some other small molecules of the same class. As a side story, since Carrie's passing, I was elected the chairperson of Toronto Concert Orchestra with the mandate to carry on his legacy. We give concerts from classical to jazz to contemporary pieces across Canada and mostly in Ontario, and I would love to invite you to some of our summer concerts on Lake Ontario.
Was there a personal moment or wake-up call that made you say, "What can we do better?"
I was thinking to myself, what can we as a biotech company and we as a society do better to tackle neurological conditions, especially dementia? The answer is better drugs, better understanding of the problems, and earlier intervention. And I think Pure Minds should work on all of that.
When people hear Pure Minds, what should they mentally associate with the brand?
While Pure Minds is a precision neuromedicine company, to the scientific world, to our humans' experience, understanding our brain is the last frontier of understanding who we are and how our body functions. When thinking of the word pure, it means mental clarity, mental health, emotional well-being, protection of cognition, and restoring the mind to its original natural state. From the scientific point of view, pure means scientific clarity, precision, accuracy, no noise, clean data, and scientific rigor.
If you had one sentence to describe what Pure Minds is building, what would it be?
Pure Minds is transforming the lives of patients with neurological conditions by pursuing next-generation precision medicine solutions that includes innovative neurotherapeutics and early intervention solutions.
What is the biggest failure in today's mental health and neurological care?
We have to admit that our understanding of the human brain is still the tip of an iceberg. Do you know that when patients are diagnosed with neurological conditions such as Alzheimer's, ALS, and Parkinson's, they have already lost over 60% of their neurons, and this loss is irreversible. Also, there is really no drug or solution that can cure these complicated diseases, especially for neurodegenerative diseases such as ALS or Alzheimer's. No therapy today can stop, reverse, or eliminate the disease process. So to me, there are two biggest problems. A, there is no drug to cure these diseases, and B, when a patient is diagnosed, it is simply too late.
Why are most neurodrugs failing in clinical trials?
It is very difficult to develop neurodrugs. The failure rate is very high. I take Alzheimer's as an example. Alzheimer's is a multi-pathology neurodegenerative disorder with at least 8 to 10 major biological pathologies, each with many subpathways. So far, scientists have discovered over 100 pathologies that contribute to the onset of Alzheimer's. You almost need to develop the right drugs for each pathology. We call it the right drug, the right patient. In drug development, there is an extremely complicated process called patient stratification. Sometimes a drug failed, maybe not because of the drug itself, but it's more because poor patient stratification, meaning that the clinicians simply enrolled the wrong patients in the clinical trial, and that's why it is failing. And patient stratification is a very difficult and costly process that requires collection and analysis of longitudinal patient data. This is why for the past decades, most neurodrugs clinical trials failed.
Why are diseases like Alzheimer's and Parkinson's always caught too late?
Early detection of neurological conditions such as Alzheimer's or Parkinson's, ALS, and frontotemporal dementia has been one of the hardest problems in modern medicine. We do not yet have a system in place to collect and analyze health and biomarker data showing changes in patients over time. There are some tests available, such as testing the tau protein hyperphosphorylation. However, these tests are all centralized in big hospitals or central labs and are very costly and cumbersome.
Why has early detection been so difficult?
This is such a big question, and I honestly do not know how to answer it properly, but let me try. First, we have to admit our understanding of the human brain is still very limited. Most neurological conditions begin 20 or 30 years ago before symptoms appear. While during this period, we call it the subclinical period, the brain has a way of compensating and bypassing damaged circuits, making it very hard to detect. In other words, the brain hides it very well. And yet, there are traces and clues we can follow if we have a system to collect certain biomarker data and do a longitudinal monitoring and analysis, such as the hyperphosphorylation of tau protein combined with metabolomics, such as short-chain fatty acids, and then we can detect abnormalities in early-stage Alzheimer's patients. Pure Minds is now leveraging our research and understanding in biomarker discovery and multi-omics studies to create a data collection and monitoring system by working with our strategic partner, SpectroChip. We're creating a system that people can track certain biomarkers and detect abnormalities through long-term tracking. This can only be possible if you have a highly sensitive detection device that can capture accurately very minutiae traces of information, and it has to be convenient enough and cost-effective enough so that you can make it available to everyday people on a daily basis. In the past, this was not possible. We're making it possible through the Pure Minds SpectroChip partnership and through the building of our 4P medicine framework.
Why should investors be excited about Pure Minds and its approach to neuroscience?
As we discussed today, the journey of Pure Minds began with a deeply personal encounter with a devastating neurological condition and a commitment to make a difference. We are always about more than science. It's all about human lives, hope, and the pursuit of solutions that can really restore mental clarity and emotional well-being. We are focusing right now on a breakthrough drug class known as neuroplastogens, including classical psychoactive compounds such as psilocybin and some other small molecule analogs. We believe this new class of drugs is really a new beacon of hope for many, many neurological patients. Well, meanwhile, we're developing a precision neuromedicine framework that can actually finally intervene early, accurately, and meaningfully. While looking ahead, Pure Minds is building a future where early detection and personalized neurotherapies are not a luxury but the standard of care. If you look at what healthcare will look like in 10 years, precision medicine will really define the future of health management and treatment. Our mission is very clear: to transform lives today while shaping the future of healthcare for tomorrow.